This is the beginning of my second week as one of the shielded, which sounds a little bit like being in a sci-fi film. But oddly, although I'm physically distant from friends and family and work colleagues, I have never felt more connected or been busier. Community Catalyst is a people-facing, relationship-based organisation, and our catalysts and connectors are people we employ, spend all their time out in local communities talking to people, creating connections, helping people collaborate, and helping people take great ideas and turn them into real stuff. So taking all that online was a real challenge, and like most organisations in our position, our first week of lockdown was as busy as we explored the best ways to keep connected, inspired and working. We already had some good virtual tools which have come into their own, but we've also rapidly come to value the many other tools out there that help people connect, and we've realised it's important to use different tools for different people. The big story for us, and I think for all of us, to come out of the Covid-19 shutdown is the one about people's generosity, their resilience, their inventiveness, and our shared determination to maintain connection despite our physical distancing. And we've been really inspired by the many ways in which our community enterprises have continued to provide help and support to people in their communities. Some have simply used online tools to keep people connected, to help people, bring people together, to talk and to reduce loneliness and isolation, which is a big problem in this kind of situation. Some have repurposed their whole building, their vans, their staff to help the NHS effort, and yet others are continuing with arts and crafts activities and music in all sorts of wonderful ways, which we will bring together at some point because they are so inspiring and great fun for people. Many of our community micro-enterprises help people stay at home. They're delivering home care, and they're actually key workers in this fight to help people stay safe, well, and to avoid the virus. And our catalysts have been working with councils across the country to ensure that they're seen as key workers, they get protective equipment they need, and hopefully have access to the testing for Covid-19 that is rolling out across the NHS and across social care ultimately. And that really brings me to the second parallel story here, which to us is just as important, and it's the one about public services really getting the vital importance of community action and the way in which they're working with organisations like ours. There's plenty of us out there to help people in local communities connect and help each other. And to do that in partnership, in recognising all that communities have to offer, and that you can enable that, but you can't control it. And if you try to, you damage it. It's really exciting to see what's possible when public services work in equal partnership with communities. All sorts of immovable barriers simply melt away, and people are really able to use their gifts and talents to help other people in a way we all want. Bright lights in a dark world.